Vitamin B1 is thiamine involved in many biochemical reactions, transcatolase reactions in the pentose phosphate shunt and pyruvate dehydrogenase, alpha-ketoglutarate dehydrogenase, and alpha-ketoacid dehydrogenase. All dehydrogenase reactions require thiamine as a cofactor. Pyruvate dehydrogenase is the main reaction that converts pyruvate into acetylcoenzyme. Pyruvate can also be converted to OAA with the carboxylase enzyme. When you combine acetylcoenzyme with OAA, you make citrate and you are in TCA cycle. So, if thiamine deficiency, because it is involved in pyruvate dehydrogenase reaction, which converts pyruvate to acetylcoenzyme, you will not have a loss of acetylcoenzyme around. Therefore, won't have much citrate around. Therefore, you won't have a TCA cycle working efficiently and less ATP. Therefore, the problem with thiamine deficiency is ATP depletion. When you go from pyruvate to acetylcoenzyme, you generate 2 NADH, and since this is into metal, you get 6 ATP. So just from going from pyruvate to acetylcoenzyme gives 6 ATP. And then with TCA, you get 24 ATPs. 6 plus 24 equals 30 ATP. The total you can get from completely metabolizing glucose is 38 ATP. So if you are thiamine deficiency, you are out 30 ATP. So the main problem is thiamine deficiency is ATP depletion. So if my vitamin B1 deficiency, it causes ATP depletion. Important, huh? So in thiamine deficiency, which you will see foot drop, which is dry beriberi, and pidgin edema, which is wet beriberi. How does this explain wet and dry beriberi? Dry beriberi, peripheral neuropathy, so that's why cause foot drop, and refers to Wernicke-Korsakoff psychosis, alcohol incident. Cannot remember old and new things like exam. Used to know that, but cannot remember now. So then in memory problem. Yeah. This one, vitamin B1. So you need to use B1. So it takes a lot of ATP for synthesis of myelin. So without myelin, you will get peripheral neuropathy and foot drop due to common peroneal palsy. Then get wrist drop, radial nerve palsy, and claw hand ulnar nerve palsy. Wernicke encephalopathy is confusion, ataxia, and nystagmus. All of these are due to demyelinization. So if my vitamin B1 deficiency, because foot drop, dry periphery. So they get because of ATP depletion as well. And then also because Wernicke-Korsakoff peripheral neuropathy. So vitamin B1 deficiency, you need to give the vitamin B1. It's a multivitamin B, B1, B6, B12, things like that. Let's say, so it takes a lot of ATP for synthesis of myelin. Without myelin, you will get peripheral neuropathy and foot drop due to common peroneal palsy. So you can get wrist drop as well, radial nerve palsy, and claw hand ulnar nerve palsy. Wernicke's encephalopathy is confusion, ataxia, and nystagmus. All are due to demyelinization. Patient with thiamine is a foot drop. Kidney edema. Now, number 2, wet beriberi, which is kidney edema, the heart failure. Most common cause thiamine deficiency is alcohol, not polished rice. So alcoholics are the most common people with thiamine deficiency. Wet beriberi is referring to cardiomyopathy, cause left heart failure, went into right heart failure, which leads to kidney edema. Heart needs ATP to function. Therefore, the patient would have congestive cardiomyopathy. Their heart will have a biventricular enlargement. The whole chest will be hard. With left and right heart failure, kidney edema is a sign of right heart failure due to increased hydrostatic pressure behind the failed heart. If you give IV thiamine, can reverse, and in some cases is related to toxicity of alcohol and cannot work. If you give IV thiamine, it can reverse, and in some cases is related to toxicity alcohol and cannot work. Example, patient in ER give an IV of 5% dextro and normal saline. All of a sudden, patient develops confusion. So confusion, nystagmus, and ataxia, and ophthalmoplegia. So diagnosis, subclinical thiamine deficiency. As soon as glucose was hung up, the pyruvate went to acetylcholine A and used the rest of thiamine. Cause thiamine for ATP, we use that. Like earlier we said. Main problem thiamine deficiency, this is ATP depletion. Thiamine become involved with the pyruvate dehydrogenase reaction. The pyruvate dehydrogenase reaction which converts pyruvate to acetylcholine A. You will not have a loss of acetylcholine A around. Therefore, won't have much citrate around. Therefore, you won't have a TCA cycle working efficiently. So keep in mind, because thiamine is involved with the pyruvate dehydrogenase, the pyruvate dehydrogenase convert pyruvate to acetylcholine A, which is to make the ATP. So thiamine deficiency, which is cause the ATP depletion. So now, if some patient have a very, right, and then we use in the ER we give for example, let's say the patient just go to ER and we give the 5% dextro and normal saline. All of a sudden, the patient develops confusion. So nystagmus and ataxia, ophthalmoplegia, plegia. So if like that, something wrong with the eyes and confusion, nystagmus and ataxia. For this condition, which is due to what? Because both glucose destroying, and then after that destroying the glucose and up then pyruvate and went into the acetylcholine A. Then they use the rest of thiamine. So then make the patient which is suddenly short of thiamine, cause thiamine deficiency sign symptoms like that. So that's why treatment we just put the thiamine vitamin B1 in. So then that we can convert condition back to normal. Okay, got it. So in the ER, give the IV of 5% dextro and normal saline. All of a sudden, the patient develop confusion, nystagmus, ataxia, and ophthalmoplegia. So there's no subclinical thiamine deficiency. As soon as glucose and up, the pyruvate went to acetylcholine A and used the rest of time in. Then went into acute rhinitis and encephalopathy. Therefore, moral of the story: give IV thiamine. So give so they recommend we need to use the IV thiamine before handing up IV glucose, especially in the ER. So this one very sensitive case. When people come in comatose or semi-comatose, several things you always do. 50% glucose if hypoglycemia problem. Naloxone, which is overdose, drug overdose. And IV thiamine. When people come into comatose or semi-comatose, and then three things need to do. 50% glucose if hypoglycemia problem. And also if a patient drug overdose or whatever. So then use naloxone and also remember IV thiamine. That's about vitamin B1, which is thiamine. Now talk about B3 niacin. This slight rash in the sun exposure area, pellagra, also known as dermatitis due to niacin deficiency. So niacin B3, 3, which you remember 3 letter D, which is diarrhea, dementia, and dermatitis. So hyperpigmentation in sun exposed area, castor necklace, dermatitis pellagra, which is rash in the sun exposure, and dermatitis. Rash is a B3 deficiency. So 3D diarrhea, dementia, dermatitis. So patient with the pellagra, niacin deficiency, look like that. Now, NAD/NADP reactions. N stand for nicotinamide, and the nicotinamide was derived from niacin. Therefore, all the oxidation reaction are niacin dependent. Example: pyruvate to acetylglycinate went to NAD to NADH, and niacin is involved here. Then tryptophan, the used in synthesizing niacin and serotonin. When it's an essential amino acid, but it's not the main source of niacin, but a good source, which is tryptophan. So nicotinic acid, least expensive lipid lowering drug. See the flushing associated with it. Supposed to take aspirin with it to remove the flushing related to nicotinic acid. Used in treating familial hyperlipidemia, so it is a drug of choice for elevated hypertriglyceridemia. Now talk about vitamin B3 niacin. So if my deficiency, so slight rash in sun exposure area, they have a rash, they call pellagra, also known as dermatitis. Oh, pellagra, which is dermatitis, keep in mind. But 3D, pellagra, dermatitis 3D, which is niacin deficiency, right? 3D, dementia, dermatitis, and diarrhea. So that's a niacin deficiency. Hyperpigmentation in sun exposed area, they call this castles necklace, dermatitis. which is pelucra. Okay, that's just like a necklace like that. This is a question. So NAD and ADP reaction. N stands for nicotinamide. Nicotinamide was derived from niacin. Therefore, all the oxidation reaction are niacin dependent. Example, pyruvate to acetylconsummate, they went to the NAD to NADH, and niacin is involved here. So tryptophan can use in synthesizing niacin. Okay, synthesizing niacin and serotonin. Why is essential amino acid? Why? That's why it is essential amino acid because involved in synthesizing niacin and serotonin, right? But it's not the main source of niacin, but that's a good source. Oh, keep in mind, tryptophan can use in synthesizing niacin, so it's in serotonin. It's not the main source, but that's a good source for niacin. The tryptophan from the chicken, the turkey thing, they have a tryptophan serotonin thing, right? So nicotinic acid least expensive lipid lowering drug. See the fluorescein associated with it. Supposed to take aspirin with it to remove the fluorescein related to nicotinic acid. Nicotinic acid least expensive lipid lowering drug. See the fluorescein associated with it. Least expensive lipid lowering drug. Fluorescein associated with it. Niacin supposed to take aspirin with it to remove the fluorescein. Oh, related to nicotinic acid. So take aspirin as well. But what a baby aspirin or 325? 81 aspirin, but what dose? Baby aspirin or what? I don't know. So the purpose, which you have aspirin there to remove the fluorescein related to nicotinic acid. So used in treating familial hyperlipidemia. So this is a drug of choice for elevated hypertriglyceridemia. Now talk about vitamin B2. So this is the cheap one, which is nice in nicotinic acid. The treat for the familial hyperlipidemia, which is high the triglyceridemia as well. So they use that treatment. Vitamin B2, riboflavin. But if a patient have a flushing, so how to reduce it? We put the aspirin. Aspirin they can remove the flushing effects due to nicotinic acid. Oh, interesting, huh? Why they did not apply in a clinical assessing for patient? Like a patient, we use a niacin before, but now they no longer use niacin. Don't know why. Not sure. Anyway, so talk about vitamin B2, riboflavin, FID, so FMN reaction, riboflavin cofactor reactions. Therefore, whenever you have a FID and FMN reaction, so these are riboflavin cofactor reaction. So vitamin B2, which is riboflavin, is involved with the FMN, right? And B3, which is niacin, which is NAD and DH, DPH, something like that. But vitamin B2, riboflavin, which is like the R, involved with the R. No, riboflavin, the F, involved with the F, ID, FMN. reaction, riboflavin cofactor reaction. Therefore, so whenever you have a FAD or FMN reaction, so these are riboflavin cofactor reaction. So niacin NAD NADP reaction, riboflavin is the FAD FMN reaction. Also, the first reaction, glutathione reductase converts oxidized glutathione into glutathione, which riboflavin is cofactor for. Vitamin B2. So FAD-FMN reaction, riboflavin cofactor reaction. Therefore, whenever you have a FAD-FMN reaction, this riboflavin cofactor, niacin for NAD and ADP reaction, and riboflavin for FAD-FMN reaction. Also, the first reaction, glutathione reductase converts oxidized glutathione into glutathione, which riboflavin is a cofactor. Vitamin B6, which is pyridoxine. Okay, 6 is a pyridoxine. B1, B6, B12, B1, B2, B3, B5, B5 biotin, isn't it? B6, B12, okay. Now B6, which you were talking about, microcytic anemia. P6 stands for microcytic anemia. First reaction in the synthesis of heme involves succinyl coenzyme A plus glycine. The enzyme is the ALA synthase and the cofactor is B6. Therefore, it is important to the synthesis of hemoglobin and heme proteins. The cytochrome system is a heme system too. Myoglobin is different from hemoglobin, has one heme group, while hemoglobin has four heme groups. There is also heme in the liver in the cytochrome system. Pyridoxine is involved in the synthesis of heme, which is in porphyrin. Pyridoxine is a transaminase reaction, most abundant substrate for making glucose in the fasting state. Alanine amino acid from muscle. Amino acids broken down from muscle to get glucose via gluconeogenesis. How can an AA to AA be used to make glucose? We are talking about microcytic anemia. First reaction in synthesis of heme involves the succinyl coenzyme plus glycine. The enzyme is the ALA synthase and the cofactor is B6. Therefore, it is important to the synthesis of hemoglobin and heme proteins. So B6 involved with the blood thinking microcytic anemia. Okay. So therefore, it's important to the synthesis of hemoglobin and heme proteins. The cytochrome system is a heme system too. Oh, cytochrome system and heme system. Myoglobin is different from hemoglobin, has a one heme group, while hemoglobin has a four heme groups. Myoglobin are different from hemoglobin. Myoglobin have a one heme group, but hemoglobin have a four heme groups. That's we know hemoglobin have a four. But myoglobin just one heme group. So should remember again. There is also heme in the liver, or in the liver as well, in the cytochrome system. Huh. Okay, so then basic involved with the synthesis of heme. Okay, and hemoglobin in red blood cell, but heme which also involved with cytochrome system in the liver. So keep in mind heme also involved in the liver. So pyridoxine is involved in synthesis of heme, which is porphyrin. Oh, pyridoxine is in transaminase reaction. Huh, so too complicated now. Remember, involves succinate coenzyme A, involve glycine, ALA synthase, involve with the transaminase reaction. Oh, too much information here. Most abundant substrate for making glucose in the fasting state. So alanine amino acid for muscle, alanine broken down from muscle to get glucose. So via gluconeogenesis. Alanine ALA acid amino acid they broken down from muscle, they release the glucose, they call this a gluconeogenesis. So break down the protein, and that's why people get skinny, no muscle, because this. How can an amino acid be used to make glucose? Oh, so right here, it just answer already through the transamination. Transamination, which is a transaminase reaction, right? But that's not good because they make the less muscle. Broken down amino acid, broken down protein, muscle. So transaminations, which is letter T, which is SGOT, so SGOT, SGBT, something like that. So that's that